Depression. What is depression? Many times people will go to their doctor feeling kind of down, maybe they have no energy, and their doctor will say that they are depressed. Well, I'm here to tell you that there is no way for any doctor to know whether or not you're depressed, all right? Because it is a syndrome, and I'm going to talk about that in a moment. However, what I'd like you to understand is what it is according to the DSM, the Bible that the mental health people use in order to assess such things. Because there's different kinds of depression that one needs to understand. So we have something called major depressive syndrome. And approximately 20.9 million American adults, or 9.5% of the US population age 18 and older, will suffer from some sort of mood disorder. The major depressive disorder would be the #1 cause for disability in the US for ages 15 to 44 years of age. That is 14.8 million American adults, or about 6.7% of the US population age 18 and older in a given year. Median onset, although it can happen at any age, would be age 32, and is more prevalent in women than men. Although I'm not really certain of that, it's just that women are more likely to get help than men. This thymic disorder is a chronic mild depression. It persists at least 2 years in adults, 1 year in children to meet the criteria for the diagnosis. This thymic disorder affects approximately 1.5% of the US population age 18 and older in any given year, which is about 3.3 million American adults. Onset, 31 years old. Then we have bipolar disorder. That affects approximately 5.7 million American adults, or about 2.6% of the US population 18 or older in a given year, and the onset of bipolar is 25 years of age. And then we have cyclothymia, which is a lower grade of bipolar. They don't have as high highs nor as low lows. I don't have the statistics on that. Now, the reason why depression is so important is because many people can become suicidal. In 2006, 33,300, or 11 per 100,000 people, died by suicide in the US. More than 90% of the people who kill themselves have a diagnosable mental disorder, most commonly a depressive disorder, or a substance abuse disorder. Many times people who have substance abuse issues get involved in the substance abuse because they have some kind of emotional disorder that they find interfering in their lives, and this is how they medicate themselves for it, until and unless they get some treatment. Now, the highest suicide rates in the US are found in white men over age 85, interestingly enough. 4 times as many men as women die by suicide because they tend to do things that are definitive, like hanging themselves or shooting themselves, whereas women will be more likely to try pills, which may or may not work, and in some cases can create some really bad permanent disabilities, depending on if the brain was affected in some negative way as a result of the overdose, or they might cut themselves. So women attempt the suicide 2 to 3 times as often as men, and those are the statistics. Now, what I'd like to explain to you is that depression is really a syndrome. There is no way for anyone to really know if someone is depressed, and there's many, many ways that people can show they're depressed. It can be through mental health issues, or it could be physical depression where they're just feeling totally, well, shall we say, like they have like no energy and they can't think well. You know, they have fuzzy thinking and their mind just isn't working the way that it would if they were feeling better. Now, there's an issue in terms of the whole idea that it's all based on neurotransmitters, because antidepressants are given because they are going to hit the different neurotransmitters, the dopamine, norepinephrine, serotonin. And these things may very well have something to do with the depression, but realize that the work that Dr. Irving did, that 60 Minutes actually did a show on his research. It was 34 years worth of research on placebo effect. He realized that the antidepressants were about 30% effective, which means that they work about as well as a placebo. So this means that something else is going on here to create this depression and what's going on with these symptoms. So how else can one become depressed? Well, malnutrition due to malabsorption is a really big deal these days. Celiac disease, which is where the gut, actually there's cilia that look like hairs in the gut, and what happens with celiac disease is that these hairs get cut down and they can't absorb the nutrients the way that they would, which means that if you're not getting enough nutrients, the basis of having everything work the way it needs to in terms of having your hormones work, that's your body, well, you may not be able to feel good. Leaky gut's another thing. This is when the cells in the gut actually start separating and partially digested food gets into your blood system, and this is what creates the inflammation that a lot of people complain about when they can't figure out what it is. Food allergies. If you can't eat certain foods, you're not going to be able to take in the nutrition there. Eating disorders is a big problem because, especially for the anorexics, if they're into malnutrition, what's going to happen is that their body's not going to be able to get the nourishment that it needs for it to function appropriately. Food is nourishment for we people, as well as all animals. Hormonal imbalances due to lack of correct nutrition creates a whole lot of issues. If you have a thyroid that's very slow, a hypothyroid, you're not going to be feeling good. You will be looking depressed, and you might have those negative feelings, although more likely you're going to feel sort of without any energy and ability to do a lot of things. Medication interactions can create depression. And even the medications, the antidepressants, they have black labels on them now because people get psychotic and sometimes they'll try to hurt themselves and are not even aware of what's going on. So these drugs are very serious, and you need to think about them very seriously before you go in that direction and rule out anything and everything else. The medication side effects, unfortunately, the doctors sometimes will listen to, many times they won't. And if you're taking herbs in combination with drugs, this can create depressed kind of feeling, body and mind as well. In fact, my partner, Donna N., wrote a wonderfully researched weblog on this website, which you can see. It's volume 88, May 10th, 2010. And it says, are you truly depressed? It may be something else. And she came up with 23 other ways that people can show themselves as being depressed rather than not. Using hypnosis, you can find out what is the problem. You can find out if there's issues. And any hypnotist worth anything will realize that there's a lot of components, as I just pointed out to you, that might need to have some testing done by a doctor or someone who's capable of getting the appropriate test done to see if it's a hormonal issue or if it's lack of nutrition, a medication side effect, or any of these other things that can be creating the problem. Because until you get to the cause of any problem, the problem's going to remain. And even if you take an antidepressant and it's working for you, that's all well and good. However, your body still needs to clear the toxins that that drug is putting into your body, and that over a long period of time can create problems itself, which is what I found out when I was being treated for manic depression with lithium. Although the treatment level looked absolutely perfect at 0.7, well, my nails got deformed, my hair started getting thinned out, and we found out that it was my kidneys starting to slow down. So my doc luckily took me right off the lithium, and shortly thereafter I was able to get some really good treatment, hypnotically speaking, from my trainer, and that allowed me to let go of the manic depression once and for all and not have to see a psychiatrist or take pills. That since March of 2004 for the letting go of the medications with her consent. And she watched me for 10 months till January 5th of 2005. And from then I've been psychiatrist free with her blessings. It is possible, it is doable, one just needs to understand the cause of the problem.